I'm Tom Huene. I'm a 53-year-old father of 4 boys, husband to my wife Christine.
Tom was very active, coached everybody's football, baseball, t-ball. We just were constantly on the move.
Suddenly things changed a lot for me in 2004. I was diagnosed with a tumor in my spinal cord. I was told if we don't do something, I risk having complete paralysis from the mid-chest down.
They were able to get the tumor out, and they advised us one of the most critical parts to his recovery would be the physical therapy, and you want to get in with the place that has the most resources available.
RIC just kept coming up #1, and so how could I not take that option?
Tom has gone through what I'd call a few different phases or goals since he's been discharged from his inpatient therapy. He initially wanted to focus a lot on walking. That was his primary goal, so we did a lot of walking in his sessions. He made a lot of progress, was able to stay on his feet a lot longer. His balance was significantly better.
There were some employees that asked me, had you ever heard about some of the research studies at RIC? And I said, no. What are they?
He participated, he worked his muscles in ways that he didn't get to use his muscles in just working at the sports and fitness center or even in rehab. So it was a good way for him to be pushed in a new direction.
Then they said that I was a candidate for robotic walking called the Locomet.
They had told him after that second surgery that he wouldn't probably walk again. So when he came here and they introduced the Locomet to him and that he would be able to stand up and move his body in that walking motion again, he was like, he cried. He was so excited.
It was almost like my old days as an able-bodied athlete. Each day that I came to the research study, it was like a game day for me. We were just off to the races. I could feel the progress. I wasn't lying to myself, it was real, and I just wanted to keep on that path.
He would go home and he would have dreams of running, and it just got him motivated again and get ready to get back out into society and just be and live.
The therapist along the way had always asked me, what are your goals? And I didn't know how to answer that for a while. I didn't answer it the first few times I was asked it. I finally said, I want to be an elite spinal cord recovery patient.
Tom is very competitive. He once told me that he needs to set a record every session.
I was there to win. And so for me, winning that day was beating my numbers from the prior workout.
Being able to succeed at something that he hadn't been able to do before. So every session, he's always looking to push himself further.
He got involved in the Paralympics and has just exceeded all expectations.
I was able to go back to my therapist and my exercise physiologist and my doctors and my surgeons and say, we were successful, we did it. We are an elite spinal cord recovery patient.
Tom's dedication, Tom's motivation is really a motivator for all those around him. He's constantly looking to push himself. I don't know if he notices how much he pushes those around him or not, but it's something that I see no matter what setting we're in or where we're working out.
When it's all said and done, when I'm 102 years old, I want to be able to look back and say, we took this as far as we could.
They helped put him back together. He was in pieces, he was shattered. This place is just the picture of hope for rehab. You just think anything is possible.